Next up will be the Sickle Cell Association of Kentucky. Prior to them speaking, I'd like to introduce Ms. Rebecca Sievers, who is the president. Rebecca Sievers serves as the president for the Sickle Cell Association of Kentucky. The Sickle Cell Association of Kentucky provides sickle cell disease information, education, and client services within the state of Kentucky and the Louisville metropolitan area. Their mission is to develop and promote favorable resolutions of issues that impact individuals with sickle cell conditions, as well as maximize the potential for public support for the organization. Rebecca has 3 children with hemoglobin SC disease and 2 granddaughters with hemoglobin SS. She's always advocated for her children, and she's now an advocate for sickle cell families across Kentucky and Southern Indiana with the goal to educate the families so they can be empowered by the information they receive. Spencer Mormon is a licensed clinical social worker and a psychosocial clinical researcher collaborative at Norton Children's Research Institute in Louisville, Kentucky. She leads project initiatives aimed at standardizing services implementation for pediatric hematology, oncology patients, and is a legislative advocate for advancing policies to mandate supportive social services in the treatment of chronic illnesses. She coordinates transition programming, community engagement, and quality improvement efforts for sickle cell disease care. At this time, I would like to bring up Ms. Sievers and Spencer Mormon.
Hi, good morning, good afternoon. Can everybody hear me?
Yes, very well.
Okay, hi, I'm Rebecca Sievers, the president of the Sickle Cell Association of Kentuckiana. We're known for the Kentucky Derby, the horses. Can you go to the next slide, please?
It's an honor to be here and to hear all of the amazing testimonials from around the world from everyone. So thank you for having us. We have started just the conversation about curative therapy at our center. And so while we've had a robust electrophoresis program in pediatrics, and our hydroxyurea utilization rate is in the 90th percentile for those who are eligible. We've just joined the consortium with Vanderbilt to be a part of the clinical protocol and being able to have bone marrow transplant for our patients. And so, so we really appreciate the opportunity to learn from everybody and to hear more about the topic. I will say in early discussions with patients in trying to get feedback from what they know about it, what their concerns are about it, it's very obvious that there's going to need to be a whole lot of engagement around the topic, a whole lot of education and awareness raised. And so one of the things that we've done at our center, because we don't really have any testimonials or experience in the curative therapy realm, we just wanted to share some of our efforts around engagement because we can see that this is going to be a really big mandated step in terms of raising awareness and education around curative therapies at our center. So here is our pediatrics team, our adult team, and Rebecca and Joanne from our Sickle Cell Association. In the last 3 years, we've been a part of the Step Up study, which is a PCORI-sponsored initiative with several centers in the United States that is geared towards increasing engagement and making it more of a integrated care team, so that these patients do not fall through the cracks from pediatric care into adult care, and so that we can take care of them and make that preparedness process and empowering them, engaging them, and taking care of them, not just a part of the pediatric effort, but it's a family effort on the adult side, and the community-based organization is very much a part of that. So you can go to the next slide. So this just shows some of the victories that we've had in the processes that we've had to implement in order to make that engagement possible. And so we didn't have formalized communication beforehand between the pediatric, the adult, and the community-based organization. And so, this just shows that in having those, very concrete steps and how to make that happen weekly and monthly, that eventually we make the impact with the engagement, the education on the patient side. You can go ahead to the next slide. Rebecca, you want to talk a little bit about our sickle cell community in Louisville?
Hi, so I'm going to tell you about the CBO and how we go out in the community and raise awareness. The top slide is there where we was at the University of Louisville. It's a fraternity called the Alphas. They have us out every year to raise awareness on the University of Louisville's campus. And thanks to Spencer, she connected us with them and also Raised Red. You can see at the bottom slide, the little girl, she is part of the Raised Red campaign, because our clinic is hematology and oncology. So Raised Red raises funds for both of the organizations, and the funds they raise for both the hematology and oncology clinic, we get 50% of those funds. There are some pictures of some of our sickle cell warriors. At the top right-hand corner, I think it's your left-hand corner, is Jessica McDowell. She is our secretary. She also has sickle cell along with her 2 daughters. And she is the one, while she works a full-time job, she is the one that gets the transportations for our sickle cell patients to the clinics, to the doctor's office, anything sickle cell related, even to the grocery store, because many of our patients are older and they're just not able to get on the bus if they had just had a transfusion or an infusion, or they're just, having pain, which all of us knows what that is like. So that's her main primary job. And then she helps us with the data with PCORI, the grant that Spencer was talking to you about. She lets us know how many times a patient needed services. We document that for PCORI, and we just document it for our records. So when we're asking for grants, we can show the need and how the need is increasing instead of decreasing.
You can go to the next slide.
Yes, please.
So this just shows how we had a targeted effort in our clinic at QI Project to link all of the patients possible with our community-based organization, Rebecca, Miss Joanne, and the Sickle Cell Association. So with this formalized referral process, we were able to take all the HIPAA issues and all the red tape out of the process and just link the patients with the community-based organization. And we had a tracking tool in order to do that, to make sure that if a patient had already been linked, that we just wanted to make sure they were getting communications and connected, and which events they might want to be a part of, or if they wanted to speak or engage in terms of raising awareness and education out in the community. And so we have a tracking system in order to actually track the engagement. If you can go to the next slide, Kristen. So once again, it's in a REDCap database, and I'm sure many of you are familiar with that and have that. And so this is where we were able to track the progress that was being made. This is an old slide, but now we've gone from where we started about a few years ago with about 20-something, 30-something patients in our registry that have been connected to now over 100 patients and families that have been connected. And the next slide, this slide shows that actually just that one formalized referral process, this shows the impact of just 5 patients out of that 100 and what the impact of that has. So if you take just 5 patients and you connect them with their community-based organization, you can see all the things that they were exposed to, that they had access to, that they were given information about, or they were able to attend certain events. And so you see like the 26 touch points of resources, services given that may have not been received otherwise by having this formalized process and this tracking tool. So even though we might not think it makes a big difference, you can see that, overall it really is key in terms of engagement, and in a project like this where we have a whole lot of families and patients who don't know about curative therapies, what's happening with curative therapy, what's available, that this is going to be one of those ways that we can spread the word, spread awareness, and engage the patients in learning about what we have available. So next slide. We were just talking about our unbridled spirit, and once again, ways in which we can try to wrap the community around our patients. Those of you who have universities or young youth groups, we were able to tap into our university student-run organization called Raise Red. And not only do they dance, and they do this big dance marathon to raise funds for pediatric hematology, oncology, but now we've utilized their amazing talents, their passion, their drive to help our patients with sickle cell disease and hemophilia and cancer to have socialization, to have that camaraderie, that support through a PAL program as well, and through virtual events where they'll have like a little prom, they'll have trivia night, they'll read books. And this is another way in which, going forward with an initiative like this, that these kind of supports in the community can be really helpful for those who will go through, the curative therapy treatments. So next slide. This is just another way, and we were talking about the importance of mental health, especially in the times of COVID. I think this has been brought to the surface as being such an important issue. And those who are not impacted by chronic illness during COVID have gotten a little bit of a taste of what it's like to be taken out, of the norm, being isolated, the anxiety of the uncertainty of what's going to happen. All these issues that those with sickle cell disease and chronic illness, have to deal with all the time. And so here's just one of the ways in which we're trying to engage our patients in having a place, a touchpad of support where we can talk about all these different topics and talk about mental health and disease management skills and family functioning, coping skills. And so going forward, I heard from many of you, and we can't understate how important the mental health and the psychosocial aspect of care are to everybody, and especially with an important step like a curative therapy. So you can go. We've incorporated virtual reality with some of our pediatric patients in order to withstand some of the procedural pain and the anxiety that goes with those kind of procedures. So this has just been one tool in which we've been able to use at our center. You can go to the next slide. So in talking to just a few of our patients and getting some feedback about, what are the problems, the most important things, we were just able to talk to just a few this week, but the patients said, for sure pain was definitely at the top of their list. And with parents and guardians, it is interesting that bone health was the top concern between all of them, but this is just from our center. But once again, mental health was mentioned, and the shortened lifespan was mentioned by all of the teenage adolescent patients when talking about the possibility of a curative therapy. And also fertility was also mentioned by all of them. And so here's just a little bit more feedback from our center in Louisville, Kentucky. Mental health on the other side of curative therapy for patients, they said lung function, and then parents, guardians, and caretakers said, pain and access to medication. And then in the next slide, you'll hear some of the feedback that we've heard from a lot of you already in terms of what the challenges are going to be going forward. And when asked what they knew and what their baseline knowledge, their awareness of curative therapy, Rebecca, if you want to go ahead and share with them some of the things that were said.
So some of the things that were said from our survey were, is it still used as a last resort? The cost, that was a really, really big concern. How much does it cost? Will insurance cover it? Will they have to fundraise for it? What's going on with the cost of it? I know someone who struggled afterwards. They're concerned about that. I haven't been told anything about it again in years, what therapies are out there now. And as if you can hear in the beginning, how at one time transplants were just for the younger children. It wasn't really for adults. So things have changed a lot. The fear patients will not be cared for throughout the entire treatment properly. That was a big concern. Then another concern, my child doesn't have a sibling, so would it be tough to get a match? So those were some of the concerns that we came across when we did the survey. Next slide, please. So the road ahead, thank you for having us here. Spencer and I love it. I have a really good working relationship with her, and I want to let her know thank you. She helps the Sickle Cell Association beyond thank you, beyond awesome. She's just wonderful. There's not enough words to describe Spencer. She's always, anytime I pick up the phone, she's like, okay, I can do it. But thank you for having us. It was really emotional hearing the different stories when you're a mother of sickle cell children, of the different stories and the transplants. So my blessings are out to you, my prayers, and thank you so much for having us here.